Good evening, Cedarfield residents and families that are going to be watching this video later on tonight. Cedarfield team members, Pinnacle Advantage members, we appreciate you tuning in on really such short notice. Appreciate you all taking time out of your evening to listen to some information and some evolving preparedness plans that the team of residents and team members have been working on over the last day or so. I wanted to get this information out to you sooner than later, rather than wait even another day for a live chat that we regularly have scheduled on a Wednesday. I thought it was really important to get this information out. We thought it was important to get this information out to you by the end of today. So I will try to be brief here, 15-20 minutes, and let the content of this live chat and the data speak for itself. Why are we here with a live chat at 7 o'clock here on the 28th of December? And what I want to speak to data first, because I think that is just really important. All along in the last 2 years, we've been talking about some metrics to use to guide us with our preparedness plan. And one of the other metrics that we've used here since March is a vaccination rate, and here recently in September is a boosted rate among residents and team members. So the good news to start this live chat really is to remind everybody about our vaccination rate and our boosted rate. We have a great percentage of people, in fact 98% of the residents not only have the vaccine but are boosted, and Cedarfield and Pinnacle Living made it a requirement of employment to be not only vaccinated but also all the team members to have their boosted shot. Additionally, we have made that requirement of all of our contractors as well, particularly private duty personnel who are in and around, really quite honestly, all levels of care, that they also have on file their vaccination rate and their boosted rate. So the good news with Cedarfield is we have a very healthy vaccination and boosted rate among those three groups of people. So the concerning metrics that we have been monitoring since last week, and when I say we, a team of COVID-19 members here at Cedarfield, along with members at the Pinnacle Living office, and our friends over at the Virginia Department of Health. What we have seen because of this other variant, Omicron, we have seen and been following some metrics, not so much with the 7-day positivity rate, although that rate is very interesting as of today, but more about the hospitalizations. When you talk about confirmed COVID-19 patients in hospitals, when you talk about ICU hospital beds, and in conjunction with the 7-day positivity rate. So yes, on Monday and the last 5 days was the third highest peak of hospitalizations in the Commonwealth since this pandemic began. The highest peak was in January of this year, and then the second highest peak was in September. And so if the trend continues over the next couple of days with what we've seen over the last 5 days, this current peak that we're on will be the second highest peak in the entire pandemic of the number of hospitalizations in the Commonwealth. So that's the first thing we've been monitoring. The second thing we've been monitoring, and we've been monitoring this really since the beginning, since March of 2020, has to do with the 7-day positivity rate. In the Commonwealth, we went from a 9.5 8% 7-day positivity rate a couple of days ago to over 15% today. In Henrico County, we are approaching 12% as of today. In Richmond City, they're up to 14%. Chesterfield is approaching 15%. Hanover 13%. And Goochland, which was always never in the double digits, Goochland is now at 11%. And so the fact that all of our surrounding counties are in the double digits, that is of concern to us. On Monday, so we're talking about hospitalizations, the 7-day positivity rate, and then testing. We have a lot of testing available to us now. In fact, every one of you that are watching have not only testing available to you here, both with a rapid test, but we have connections to the state lab and can do PCR tests. But really, everybody can go to a CVS or a Walgreens now. So testing is widespread. And so with that in mind, though, on Monday, we tested 80 people here at Cedarfield, team members and residents, for one of two reasons. One, because they were exposed, meaning they were within 6 feet of somebody for more than 15 minutes over the holiday week, last week, and or they were showing signs and symptoms of COVID-19. So we tested 80 people on Monday. We haven't tested 80 people like that since May of 2020, when the National Guard was here. And so testing that many people was of concern to me on Monday. And that trend has continued today, and hopefully it starts to slow down as the week progresses. All of that to say that we currently have 8 active COVID-19 cases. And they're a little bit of everywhere. But, in last year in 2020 and the beginning of this year, we had 1 or 2 here and there, but they were isolated to certain areas. And now all 8 of these are across the community. We have a couple cases in the cottages. We have 2 cases here in main building and independent living. We have 1 resident case in healthcare. We have a private duty case emerging in Morning Glory. We have 3 team member cases in independent living. So it's not just healthcare, which was everyone's concern at the height of the pandemic. So we have 8 active cases that we know of right now. And I am sure that, hopefully we don't, but I'm sure as the week progresses that number, with testing 80 people in one day, I'm sure that number is going to increase throughout the week. What we have found through root cause analysis or contact tracing, that of those 80 tests that we did on Monday, 90% of them, so we're talking about 70 cases, people have told us that they can link the exposure back to a family member, a friend, a visitor that has either come to Cedarfield or during a holiday gathering they were exposed to somebody. So a little bit of good news in that is that when people were telling us through contact tracing, where do you think you were exposed? It wasn't a Cedarfield resident, a Cedarfield team member. It was situations beyond the gates of Cedarfield. That should give you a little bit more confidence as we progress through this live chat. So all that metric that I just shared with you gave us pause, and we've been working over the last 2 days to kind of make sense of it and decide what's in the best interest to protect the resident at Cedar Field, protect the team members at Cedar Field, and really protect everybody. Safety first. And so looking at these metrics and taking into consideration, it's really not the best time to talk about what I have published and or about to talk about, given it's the holiday season and New Year's is upon us. But we really firmly believe that we need to be proactive right now and get ahead of this curve and scale back our preparedness plans to a level that keeps people distant, trying to lower some of these numbers. And so what we did is we talked about the Cedar Field Forward Plan. Otherwise, some people kept calling it throughout the day the Omicron Response Plan. But what we did is we took our Cedar Field Forward Plan that we were publishing for the last almost year and 9 months and looked at what was the last version of it in the summertime, around 4th of July. And we want to go back to that level. And so with many items, but there's one big item that we really believe that we should all wrap our arms around and rally around in order to protect ourselves and to protect our neighbors, protect our colleagues. And since 90% of that contact tracing had to do with a family, a friend, someone outside of Cedar Field, what we're going to do between tomorrow, effective tomorrow, all the way through January 13th. So we want to take these next 2 weeks. Traveling has not slowed down, although over the weekend it did with the air travel, but many people have felt the need to go see family and friends. What we want to do is curtail visitation, definitely at Cedar Field. We are asking residents of Cedar Field to stop visitation for the next 2 weeks. We're not mandating that residents stay at Cedar Field, although we are strongly recommending that if you have to go out for groceries or the pharmacy, please go do so. But by and large, just really take these next 2 weeks as a kickoff into the next new year and isolate as much as you can. We're not asking people to isolate, but we are really asking residents to take accountability in your own hands and really try to stay away from people, definitely 6 feet, if you happen to leave the community. But we are, without a shadow of a doubt, not wanting visitors to come to Cedar Field for the next 2 weeks. In independent living, in assisted living, in memory support, and in healthcare. Those of you that are watching, residents, if you have somebody, a spouse or somebody that lives in one of those levels of care, we want you to go over and spend time with them in that level of care. So we're not asking residents to restrict yourselves to your apartment. You can freely move about the community here. We just don't want visitors at Cedar Field right now for the next 2 weeks. It will help greatly if you can reduce the number of places that you go in the next 2 weeks. And I know as hard as this is, given the fact that New Year's is a couple days away, I've just canceled my New Year's plans. It's just going to be Julie and I and the kids. But as much as you can stay away from groups of people and just really hunker down here at Cedar Field, really the better off we're all going to be towards the middle of January. And so that's the big part to this Cedar Field Forward Plan, is having to do with visitation. I don't want to go over this entire document, but every resident and in independent living, assisted living, and memory support should have this document. We've created A Cedarfield forward plan for residents in independent living. It's in your mailbox if you live in a cottage. If you're here in the main building, it's already in your cubby box. Residents in assisted living that are watching, you have a separate neighborhood plan. The residents in memory support have a separate neighborhood plan. Lavender Lane, the residents in healthcare on the 5th floor in the household building have a separate plan, as well as the 2 neighborhoods in healthcare on the 4th floor. So the families that are watching here tonight, if you have any questions, if you have a loved one living in our licensed area, I would refer to our Touchdown. You can see the postings of the plans on Touchdown, and or contact the neighborhood leader or the clinical leader tomorrow with any specifics. A couple things I do want to highlight, particularly if you are a loved one and have somebody on the license side. If you want to drop off supplies to some residents, we're going to start gearing back up for that park and ride that we had over on Mayland and Gaskins on Fridays at 1 o'clock. If you have to take somebody out for a medical appointment in a healthcare setting, we want you to continue to do that. We will test people every 5 days upon return. Again, if you are living in independent living, the cottages in the main building, if you have to go to a medical appointment, we want you to do that. And if you feel any symptoms coming on, we want you to come down to the wellness clinic so that we can get you tested. So Katrin and the team are going to modify the informer a little bit. If you have any questions, contact Katrin and the team tomorrow. Katrin did want me to let y'all know that there are some events that you have to sign up for. There's some registrations for the month of January. She said hold off on returning them. She's going to come up with a new form for tomorrow to make things easier for folks. So one of the most frequently asked questions we got all day long today, without even publishing this plan, many residents and families were calling, were should residents travel on airplane or train or taxi or Uber in the month of January? And given the guidance from the epidemiologist of Virginia Department of Health and looking at this data, even just looking at air travel over the weekend where there was 4,000 flights that were canceled because crew members were calling out sick, we would strongly advise residents to just stay at Cedarfield in the next 2 weeks. Take your health seriously and really don't travel by mass transit. And we don't want residents to hibernate. If you this Omicron is highly contagious, 10 times more contagious than the Delta variant, and even more contagious than what we were dealing with in the beginning. And so if you have a scratchy throat, sniffling, if you are become really maybe even a little bit lethargic over the next couple of days, really don't even chance it. Don't hibernate. Come down to the wellness clinic. Let's get you a rapid test. We have plenty of them. And we have availability at our fingertips to get tested through the state lab here, which is an enormous benefit to us, which is a concrete test that can definitively tell us whether somebody is positive. It can't tell us whether someone has Omicron, Delta, but it can tell us whether someone's positive. And so it's a confirmation with the rapid tests that we have in the clinic and or in the licensed side with the rapid test as well. So please don't hibernate. Now is not the time to just take matters in your own hands. We really want to be one with you in helping protect you and protecting everybody else. There is new guidance from the CDC that talks about from onset of symptoms or testing, what somebody's maybe quarantine period of time may be. And so it really is confusing guidance. And so what we're just asking, if residents have symptoms and or if you were known to be exposed, come down to the clinic in independent living or call them first. And if a resident or a family member that's listening know of somebody in healthcare, just call the clinical leader and we can walk through the guidance. What is crystal clear to me is what is defined as an exposure, which is if you are within 6 feet of somebody for more than 15 minutes over a 24-hour period of time, you would be considered having been exposed if that other person had COVID-19. And so that seems like a pretty easy one for everyone to remember. All the other guidance as to when to get tested, how often to get tested, I think it's better off that we call down to the clinic or the clinical leaders to help with that guidance. And so we're going to, at one point here in the summertime, we had a lot of events in the fellowship hall. We had some big gatherings out in the wellness courtyard. We're going to take a step back. We're going to get back to that social distancing quantity within our common space areas. And so we're really going to hold true to a cap of 25 people in the fellowship hall. As an example, in the chatterbox, we're going to limit seating to 10 so that we're all properly 6 foot away from each other. That much we really know. Mask wearing, and not just any old mask wearing, a surgical mask with good 6 foot distancing from one another, good hand washing and or hand sanitation, along with being boosted, should really rule the day in the next 2 months. The other thing that I have always been using, if you don't have one, they still have them at CVS. In addition to a thermometer, these oximeters are just really a powerful way to know what your oxygen level is in your blood. This is showing 97, which is a great number. If you don't have one of these, this is another really great tool to have in your apartment to know what your oxygen levels are within your body. A sure tell sign that something's going on beyond just having a fever and or other symptoms. So I think everybody can read the rest of the Cedar Field Forward Plan throughout the evening. If you have any questions about it, we are here to answer them tomorrow. You can feel free to email and or text. If anybody has any questions right now, I'll answer some questions. One of the questions came in, may someone come from the outside, pick you up, take you somewhere, and then bring you back? Somebody could do that. We are advising not to do that, but we're not under a lockdown mode right now at Cedar Field. What we want to do is just, again, we want to try to help you, help yourself, help our community stay distant from one another. We're not mandating that nobody come. If somebody has to come to pick you up and take you somewhere, we're asking that those visitors do not come into the main building and or come to the cottages inside of your cottages. If those of you that live in the cottages, if you have to have somebody come pick you up, can you please just respect the rules and go outside and join that driver, that friend, to take you off site. So we're not mandating that people stay at Cedar Field. What we're really asking is residents to keep your visitors, your families and friends away from Cedar Field for 2 weeks, and for you to protect yourself as much as humanly possible, and stay socially distant from people, and stay at Cedar Field as best you can. for the next 2 weeks. 2 other questions came in. Is it safe to go to the beauty shop tomorrow? Absolutely, it's safe to go. It's part of the plan. We've asked the beauticians with our protocols, and they're fine. So it's fine to go to the beauty shop tomorrow. Another question came in. Does Cedarfield have access to any of the antiviral medicines? And we do not have access to them. And either does Remedy. I don't believe Remedy has access to them downstairs in our pharmacy. I'll get clarification of that tomorrow. That's a really good question. One other question came in. Can someone pick me up for a medical appointment and take me off the property? The answer is yes. Somebody can come here. We're respectfully asking that they either come to the front door of the cottage, the main building here underneath the porte cochere, or Parkview entrance, and just not enter the main building. And the same thing goes for healthcare as well. I don't see any other questions come in. I'm sure there's lots of questions, as we always have questions that come in after we publish a Cedarfield Forward Plan revision and update. Just want you to know this isn't an easy decision to make, especially at the time of year that we're in. But wholeheartedly, I believe that this is the right thing to do, especially given the data that I shared at the top of the hour, to protect ourselves and protect our neighbors, protect the team members at Cedarfield. I'm following our own advice. Julie and I, again, are not doing anything on New Year's. Canceled a Philadelphia Eagles trip up to a stadium in Philadelphia to see my beloved Philadelphia Eagles. So I'm taking it very seriously, and I think the residents of Cedarfield should, the team members should, any private duty personnel should take this seriously. The families, we are just respectfully asking that we follow this guidance. Let's take these next 2 weeks and understand what this Omicron is really doing at Cedarfield and really around our surrounding area. Let's be a little bit more preventative and take matters in our own hands. One point I did want to mention that I forgot at the top of the hour, CDC and to a greater extent Virginia Department of Health consider an outbreak of COVID-19 or a respiratory illness. Before this pandemic, it was a percentage of residents at a community in a community setting. Today, what is considered an outbreak is anything more than 1. And so no matter the size of your population, here at Cedarfield we have 527 people live here and 300, close to 300 people that work here. They still consider an outbreak more than 1. And so the fact that we have 8 cases, we fit their definition. And so we want to take it seriously. We want to partner with Virginia Department of Health, be a little bit more proactive than we have been over the last 2 months, and protect ourselves and protect the community. Please call us with any questions you have tomorrow. Feel free to email. I'll be up till 11 o'clock tonight answering emails and or text or returning calls. And we will get through this together. We're absolutely stronger together. We have been stronger together for the last 2 years going through this pandemic. And this will be no different. We will be stronger together by going through this. All for one, one for all. And again, if you have any questions, just contact us. I thank you for listening. I know that many of you changed your plans tonight, dinner plans and or meeting with family and friends to listen to this information. And I just want to say thank you. Have a good night, and I'll talk with you tomorrow.